Hello, everybody. My name is Brian Toten, CEO of Crown Biome, and we are bridging the gap between dentistry and medicine with our landmark project, Suboral. Chronic inflammation is nothing more than just a microbiome imbalance. The homeostatic state of the microbiome consists of over 1,000 bacterial species that are inhibiting fungus and viral growth, and it is suppressing disease. However, through environmental factors such as stress, pharmaceuticals, and even lifestyle choices like our diet, we can shift our homeostatic state into an inflammatory state. And this ends up being the root cause of almost 95% of all chronic illnesses, including cancer, cardiovascular diseases, and neurological disorders. Now, the problem with microbiome monitoring is that there really is a lack of convenience in routine monitoring. 6 in 10 people have at least one chronic illness, and this equates to about a $3.7 trillion economic burden in the United States alone. The current standard is stool. However, it is unsanitary and unpleasant, making it unlikely that people are going to do it more than one time. Saliva, it often yields a lot of discrepancies through a lack of microbial density, as well as because it lacks integrity, will degrade during transport. Now, suboral is a dental plaque holistic diagnostic. Using the convenient sampling technique using paper points, we are collecting subgingival plaque underneath the gum line. Dental hygienists are trained and specialized professionals that can alleviate the burden off a dentist to actually collect conveniently during your routine biannual dental hygiene appointment. Now, dental plaque actually has the highest DNA integrity out of any sample type, including stool sampling. It's also within close proximity to our nervous and circulatory system. It has almost twice as many bacteria compared to saliva, and it also has fungal strains which are necessary to detect if we're going to be able to detect inflammation, unlike saliva sampling. Now, our goal is to create a complete patient profile where we will be able to use our microbiome as a baseline to be able to determine onset diseases. We are going to create what's called a suboral microbiome quotient that will allow us to longitudinally analyze your health over a period of time using an objective metric to monitor chronic inflammation. And so this is done by giving you a score, so you would be able to easily interpret if you are inflamed or not. Now, we're going to be pioneering the microbiome dental medical integration through telehealth API integration within the electronic health records. This is going to allow us to be the only company to have the most efficient data collection in bioinformatics. And this is saying every company does not do this. This will allow us to have a preventive medicine tool, allowing dentists to operate within interdisciplinary teams so that they could be one provider among a network that is providing a holistic approach to medicine. Dentists are already learning about the oral systemic link in dental schools, and using artificial intelligence and machine learning, we can access wellness professionals and wellness tools that are going to allow for personalized treatments and improve pharmaceutical and therapeutics. And this is why we are ranked at S6S for being the 49th top company in AI infrastructure in March. Now, this is disruption in value-based healthcare. Dentists should see an increase in the revenue of up to $200,000 annually, which is a 25% of their revenue being increased. Health insurance savings should see about $3,000 per patient. Now, patients are already paying $6,000 in direct care costs for chronic disease management. So we expect to see about a reduction of 50% in healthcare savings. And we want to be like the 23andMe of data distribution. 23andMe actually sold one of their subsets of data to GSK for $300 million. And because we're going to be the most efficient company at collecting data, we will be able to build data sets quicker and more effectively, clinical data sets that allow us to be sold, for therapeutics, for pharmaceuticals, for wellness products, and so on. Now, we are entering into an untapped $165 billion total addressable market with an 18-month commercialization plan. The total addressable market was calculated for every patient that could go to the dentist, after the age of 2 years old. But the servable addressable market is probably more so where we land. 70% of Americans go to the dentist at least once a year, whereas 53% of Americans go to the dentist twice a year. So the market is substantially larger than you may suspect, and our goal is to obtain $100 million within 3 years. Now, our target markets, which is going to allow us to obtain that our target revenue, is by accessing the dental schools. We can create a sustainable revenue stream by teaching current and future dentists how to utilize suboral into practice. They also see up to 20,000 patients per year within an annual visit to the dental schools, and there's over 86 dental schools in America and Canada. Now, dental support organizations will allow us to access uh, over thousands of dental offices and can be within networks of sometimes over 20,000 dentists um, through telehealth networks. Many telehealth networks, such as Dentrix, such as Epic, they have an electronic health records that allow for dental medical integration. Now, by accessing and incorporating our algorithm within the API of those electronic health records, we will be able to mitigate our marketing costs and be able to expand our product into multiple dental offices that allow us to maximize our revenue in a very short amount of time. And our third target is dental implants, which is a critical care need because dental implant failures are rising uh, due to the microbiome actually promoting inflammation, which causes gum recession, periodontal disease, and even bone loss. Now, the management team is made up of myself and Dr. Paquette. I'm the founder and CEO of Crown Biome. I have my master's degree in engineering management. I actually wanted to be a dentist for the longest period of time, where I came upon this proposal back in 2019. And Dr. Paquette, he is the principal investigator of suboral. He is currently the chair of surgical sciences at ECU School of Dental Medicine. And many of my advisors, including our principal investigator, they are working within our strategic partnerships, such as Dr. Nur Hassan, working at a bioinformatics laboratory. Dr. William Jackson, he works with virtual dental care. We will actually be accessing teledentics as our first telehealth platform that we will incorporate our algorithm within the API of their electronic health record. And Dr. Bassam, he is the CEO and CTO of Maui DNA. They already currently manufacture a biosampling vial specifically for suboral to drop a paper point with a subgingival plaque sample into a cryo vial for shipping and logistics. Scott DeRossi was even the founding dean of High Point University and founded and brought in Pacific Dental Services to act as a dental medical integration software for the dental school to train dentists how to work within interdisciplinary teams. Now, we're currently raising $1 million preferred equity pre-seed round on a $5 million pre-money valuation. The use of funds will be towards our sampling protocol at ECU, along with our research and development and piloting. And we suspect that we will make around $350,000 within 5 years of being commercial with suboral. And I'd like to thank you so much for paying attention, and I look forward to hearing from you for investment.